And so along those lines, what are the little things that make you happy, make you joyful? So we'll go around with that, and I will start with Pamela Joyner. What's a little thing that makes you happy or uplifts you?
Sorry, Dr. Boone, my computer acting up. Good morning.
Good morning.
Now, one of the small things I enjoy is rest, that
Mm,
peace and quiet when you finally get home and can rest your brain and not have to think about all the hecticness of the day. So
mhm.
that peace
Yeah,
I'm enjoying.
thank you. How about you, Paula?
Just being able to take a few minutes and just sit and do nothing. My day starts real early. And so I've learned to I start off by saying my meditation and prayer, but then during the day when it gets so busy, just taking time and just sitting in a chair and doing nothing.
That sounds so good.
Yeah.
And Stephanie, how about you?
Good morning. Can you hear me?
Yes.
Okay, perfect. Um, Now what brings peace and joy to me is being able to spend time with my family. We're all older now and we don't get together like we used to when my grandmother was alive. So it's nice to be able to come together sometimes and just, talk and catch up.
That is so nice. Mindy, I don't know if you can answer because you're driving and doing many.
Yeah. Can you hear me or
Oh,
am I on mute?
yes, no, I
Oh,
can
good.
hear you.
Okay. No, this is such a nice icebreaker. Listening to everybody's. I enjoy too just quiet time more now than ever. But I love that I can wake up and hear the birds
Mm,
and the flowers right now and smell the honeysuckle. My neighbors have a patch between us that by
mm,
the driveway, and it's like, oh, thank you, God, for nature. And I love getting my hands dirty and planting flowers this time of year. And then my grandchildren, I have to add that just spending time with little ones who just stop and pick up stones and they stop and, they're captivated by the littlest things. And I am so glad to be reminded of the little things. And my grandchildren help me do that. So
yes.
thank you.
Thank you. How about you, Nicole?
I was just thinking of something that is starting to happen again since the pandemic has always given me joy, which is box lunches. I love when you go to a meeting and someone gives you a box that has everything in it. It's got a cookie, it's got chips, it's got a sandwich, it's got a little napkin, a little packet of mayonnaise. That just gives me joy.
That is so nice. I love that. Nancy, how about you?
Yes, I'm glad you mentioned this because I haven't done this in a while. But yesterday I was able to sit down and look at the trees, and I really much needed it. My mind and my body needed, and it was even better when I did it with Natalia. So God gifted us this beautiful view. Then three deers passed by, so we were able to take pictures of the deers. So just basically nature. I love nature. You guys know I lived in the country for a very long time, and I just love nature. And that brings me a lot of peace. It brought me a lot of peace.
How about you, Judith?
Well, I was just listening to everyone and how it just reminded me we've went through this, past few years with the pandemic and how this helps us, just think of the little things, to be grateful for the little things. So my thing that brings me joy is my grandkids. Now, so I'm looking over the other way because something said, restart your computer now. You know that is not okay. This device will restart to update. No. Oh my God. But let me just look real quick. So I don't know what to do to turn it off. Turn off all no. I don't know what to do, Wanda. So I hope this doesn't happen because I didn't have an update set. But my thing is my grandkids, they bring me just such joy and peace. When they get here, they're a little crazy, but just the thought of them coming is just so exciting to me. And one of them told me one day, "You're the best grandma ever." I wish I had it on to record it. Was running in place. Oh my God, my heart just went nuts. So let me just, while you're walking through, just let me make sure I get this thing off because I should not have an update for anything. So give me a second.
Okay.
Go to notification settings. Maybe I can do that. If you have any other housekeeping stuff, if you can do that, Dr. Boone, so this doesn't happen to me because I don't know what to do.
Okay.
It won't cut off.
Well, you're still here, so maybe all is well.
I don't know.
I so envy people that have grandchildren.
Uh-oh.
I don't have any. Well, all the ladies in my Women and Children's Auction House, they know I'm a kid, and they know I'm a kid free. I love kids, but I have none of my own, no grandchildren, and I really, really miss that.
Well,
And my children said it doesn't look good for me. That's what they said, "Ma, it doesn't look good for you."
Oh no.
You know what, Paula? One of the things that I sometimes, and I'll say this and shut up, like all my family is gone. So I'm the youngest in my family, and my parents and all of my siblings are gone. And so what I've done, I've just adopted all the time, this whole new family. So if you can get you some little grandbabies, little babies, and and just love on them. And then, sometimes we can't change what the situation is, but we can do something. It's just like I walked past that patch of honeysuckles. Automatically, it took me home. So I believe that it will bring the same joy because I know it does for me. I mean, I don't even feel like, oh my God, I'm so sad that my family is gone because I found a way to not to replace them, but have family.
Yeah. Well, that's why I use the Oxford House children.
All
the Women and Children's House, they know that when they come, I go over for a meeting, I gotta have a hug. Come on, you know what to do. You know what to do. Yeah. Come on.
Yeah. And I, like Jude, it's not, well, all of my aunts and uncles, my parents, some of my most favorite people within that group are gone. And, even though we have children, grandchildren, I've built other family members and, so it's a beautiful life. Okay, so thank you so much. That was really refreshing. Okay, so I'm going to introduce Jude. You saw it in the email, but I just want to read this so that as things are getting together, Judith Johnson Hostler, with all those initials after her name, LCMHC, LCAS, LEVG, NCC, CSI, is a master's level clinician who has worked in the field of counseling and addiction for over 20 years. She obtained her second master's degree from North Carolina Central University in clinical mental health counseling. She obtained her bachelor's degree from Thomas Edison State University in Trenton, New Jersey. She is a licensed clinical mental health counselor, which is the LCMHC, a licensed clinical addiction specialist, LCAS, a licensed evangelist, LEVG, a national certified counselor, NCC, and holds a clinical supervision intern credential, CSI. She is passionate about her work as it relates to helping individuals overcome obstacles that have and can hinder their emotional, spiritual, physical, and personal growth. She finds great pleasure in watching individuals and families use skills learned through counseling, ministry, and coaching, accept that they are enough, exclamation point. She is a native of Asbury Park, New Jersey, and moved to Raleigh 10 years ago, I think it's a little more now, and she absolutely loves the South. She recently co-authored a book, Through It All, We're Still Standing. Her book made the Amazon's #1 bestsellers list. Her favorite pastime is traveling and spending time with her hubby, who is wonderful, and her grand loves. Thank you so much. And without further ado, Jude is going to give us a very important presentation, a training on fetal alcohol spectrum disorder. Jude, please.
Okay, so I'm gonna pull the PowerPoint up, but I've tried to see if I could reset this notification. I've never had this happen. So if I'm off, you guys know I'm gonna come back on. One of the things that I want to do, let me pull it up really quick. Hold on. Give me 1 second. Can you guys see my slide?
Yes.
Yes.
Okay. So now what I'll do is I'll use the last slide will have an evaluation on it. You can, you can scan it as a QR code there, or you can just go to the link itself. With the QR code, I think I'm going to take and put the link in the chat, but with the QR code, you can just, take your picture and go on and do it. What we'll do is once you do the evaluation, your name will go in a little pot to be picked for a $25 gift card. And so I will just go ahead and get started. So talk about a little bit about Proof Alliance. I don't know if you guys have met Amy Hendricks. So Amy Hendricks was the director of fetal alcohol spectrum disorder in Asheville. And she has a different title. So when I say was, what she did was in the beginning, when I moved here to North Carolina, I came here from New Jersey, where I was a coordinator of the Fetal Alcohol Spectrum Disorder Project. And so, but in New Jersey, which is, much smaller than North Carolina, there was 12 of us. So each one of us, there was 6 of us, and each one of us had an assistant. Well, in North Carolina, Amy was by herself. And so there's 100 counties here, and she was expected to, cross all of the counties and do the work that she needed to do around fetal alcohol spectrum disorder. And that is just a huge task. And so I remember when I got here, she had a few different coalitions and tried many different ways. And so recently, just before COVID, what she did was she joined with Proof Alliance, and Proof Alliance is out of, Minnesota. That's where a lot of the main work goes around fetal alcohol spectrum disorder. But here in North Carolina, they formed a chapter. And so Proof Alliance NC strives to prevent alcohol-exposed pregnancy by providing training, education, resources to professionals who serve individuals of reproductive age, delivering preventing messages and resources to individuals who can become pregnant, and sharing resources with professionals who provide supports to families and individuals impacted by FASD. So what Amy did was she formed a speaking bureau. So there's over 25 of us, and we began to do training. It started just before the pandemic. So we were going to be training together in person. And so for the first couple of years, it was not. We were doing virtual training. And then last year, we finally came together in person. And so some of us focus on working with individuals with substance use disorders. So that's my area that I work with. And so I'm a part of T.R.Y for Resilient Youth. And so I wanted to present this information to you guys. So when we talk about working with individuals that are in treatment facilities, this information still applies to classrooms. So anyone that is a teacher working with this population, or just what we, have to be always mindful is that anyone that has an FASD, they'll grow up to be adults. And so anyone that could be working with someone with this in this population. So you'll see that the numbers are pretty high. So today we will cover, what I asked is that Nancy will cover the chat. And Nancy, can you see the chat? Because I can't see it when I'm presenting.
Yes, I can see the chat.
Okay, good. So you'll cover the chat. Any questions that people have, you can present them during or even wait till the end. So here's the roadmap of today's presentation. Everyone will learn what fetal alcohol spectrum disorders are and be able to identify characteristics associated with prenatal alcohol exposure and summarize strategies to support individuals on the fetal alcohol spectrum. So I must admit, when I started doing this work, it's been at least 20 years ago. I didn't know, I did know the term fetal alcohol syndrome, but I didn't know much else than that. And I had been working at that time in the field for at least, I want to say about at least 11 years. So I know my bio says over 20 years. I say over 20 years because I don't want to say over. I have been working in the field now over 30 years. And so when I started this work, I would have clients that would tell me things like, if I had a client that was a heroin user, using heroin IV, they'll say, Miss Jude, I stopped using heroin, but from time to time, I'm drinking a little beer. And so I kind of looked at that back then as a win before I knew about this information. So we'll go over what fetal alcohol spectrum disorders are, the prevalence of prenatal alcohol exposure, and fetal alcohol spectrum disorders. That's the FASD, and that's the common characteristics and those with prenatal alcohol exposure, and the importance of developing strategies to support these individuals. So these strategies will fit in whatever wherever you're working at. These strategies will fit. So FASD stands for fetal alcohol spectrum disorder, and it is a permanent condition that is caused by prenatal alcohol exposure or drinking alcohol during pregnancy. So FASD has a common wide array of symptoms that can be physical, cognitive, behavioral, and learning impairments. That's why when we hear someone say, I drank during my pregnancy and nothing was wrong with my baby. Well, they're just looking for the physical appearance to see if something's wrong. But if there's brain injury, you can't always see that right away. So there's not one common characteristic that every single person with FASD has. We will talk at length about what those characteristics are a little bit later in the slides. There is hope for the future, but at this time, there's no cure for the impacts of prenatal alcohol exposure. This is one of the reasons why it's important for you to hear this today. If a person on the fetal alcohol spectrum they have the right for support, research shows their overall life outcome is better. One of the terms we used to use, which is not, they don't use it anymore. We would say that someone with the FASD, one of the greatest supports would be an external brain. So what that would mean is that if you had a mom or a counselor or a teacher or that particular person that was thinking for you, that would be, a lot of support. But what happens when that person is not around? So what I seen was that I had a woman, and I could share this because she shared it and always said we were able to share it. She was one of the doctors that I worked with when I was in New Jersey, and she's MD that works around this work. And one of the things is that she had her own experience. And so as a young woman, in medical school, she struggled with alcoholism. And so she had married and, went into recovery and had her, got pregnant and was drinking from time to time with one of her children. And it appeared that that child was fine. She had the next child, same thing. Her youngest child, Michael, was diagnosed with FAS. And so he had all of the characteristics of someone with FAS. And then what happened was her child, the oldest, was very successful, really smart, went off to college. And when he got to college, things fell apart. And that was because his external brain was not there for him. And so they went in, they got this young man diagnosed, and he did indeed have FASD, and he would train with us. And so they began, that is an old term. They no longer use it because it is not helpful. It really isn't. It's okay that we're guiding our children or the youth that we're working with in certain directions, but we can't be their brain because we're not going to always be there with them. So the first diagnosis of fetal alcohol syndrome was made in 1973. This doesn't mean that the impacts of drinking during pregnancy didn't exist before then, but that was the first time the medical community recognized the effects in diagnostic capacity. We are still learning about the impacts of prenatal alcohol exposure each year, but overall, the main conclusion of the research has been that there is no known safe amount of alcohol during pregnancy. In terms of supporting individuals with FASD, it is important to remember that no two people are the same, that this is often a brain-based disorder like Alzheimer's or dementia. There are physical effects on the brain that impact behavior, and that most importantly, all people with an FASD have the ability to learn and to reach their full potential. Approaches just need to be modified to meet their unique needs. Success will look different for each person. Okay, so FASD is an umbrella term. FASD is not a diagnosis in itself. As I said, it's the umbrella term in which the 5 diagnoses fall under. The diagnoses include the one common one that most people know is FAS. That's the facial abnormalities, growth defects, central nervous system abnormalities, and neurobehavioral impairment. Partial fetal alcohol syndrome. So facial features, you might also have heard the term FAE, so fetal alcohol effects. This is outdated. This is an outdated term and isn't used by the medical professionals anymore. There are different criteria for each of these diagnoses. We won't get into the specific criteria right now, but what is important to note is that the actual diagnosis doesn't tell you the severity of the disability. Regardless of which of these diagnoses a person has, they were impacted by prenatal alcohol exposure, and that person will have their own unique challenges and strengths. So one of the questions that often comes up, what about dads drinking? Well, at this time, they don't have any research that supports that dad drinking could provide FASD. But of course, we've heard the research around a child that comes from a family of someone that has substance use disorder, that child could be have a predisposition to be have their own issues with substance use disorders. So despite all the research that says that alcohol is dangerous during pregnancy, it is still very common in our communities. We still hear, I was on the training the other day, and one of the people put in the training that she had a family or a friend that the doctor told them to have a glass of beer, every, so often that really helps with the growth of the baby. Now that was the first I heard that one. Now I have heard that wine is really good. So that's sad that we still have doctors that the medical community is still, doesn't realize the severity of this. So it is still common in our community. So overall, it is estimated that up to 1 in 20 children in the United States has an FASD. So that's, if you have a classroom of 20, one person could be. So this makes FASD more prevalent than spina bifida, which is 1 in 2,500, Down syndrome, 1 in 700, and autism, which is 1 in 59. So although this research focused on children, we must remember that children, as I said, grow up to become adults. So there are some facial features. So we'll look at the facial features here. So the facial features that can result from prenatal alcohol exposure, which include a thin upper lip, that is, and the philtrum. So the philtrum is this little dip, if you can see my picture, that we have in our, above our lip. So it's that little groove in between the nose and the eyes. And so the nose and the mouth. So there's smaller eyes. While people may think of facial characteristics when they think of FASD, the vast majority of individuals with FASD actually do not only have any of these facial features. In fact, 10 to 15% of people with FASD have these facial features. This is because there's only a small window of time when the facial features are being formed. So now that does not mean that during pregnancy that if it's only a small window, like when is that window and is it only that window that the child could be affected? You'll see in one of my slides that the child can be affected at any time. And so I have like such an embarrassment. I remember when I first started doing this work, I didn't have my graduate degree yet. And I noticed in graduate school, there was a big focus on culture and microaggressions and just things that sometimes that we might be ignorant to. And so one of the things that I did myself, and I was mortified when the person, and I had did it for a long time before someone corrected me. So I said, and please, while I'm saying this, don't take this as any type of disrespect. I'm using this example on myself to say sometimes we just don't know. And so as I was describing the eyes, I said, like when someone has chinky eyes, and I just did not realize, it just did not dawn on me that is horrible. That is a microaggression. And so I mention that because sometimes even if we are offended by things that people say, sometimes they might not know, because I didn't know, and I never made that mistake again when someone corrected me. So if there's alcohol exposure before or after that window where I talked about that early time, that alcohol can impact the brain development, and there may not be any visible features of FASD. So when you hear a person say, my child is fine, a lot of times we're just looking at the facial features. So by far the most serious effect of prenatal alcohol exposure is the invisible brain injury. Although these pictures, let me see. So in my slides, it'll have all the research too, where this comes from. So Nancy, do we have anything in the chat?
I was just checking. No, we don't.
Okay, good. I wanted to make sure you guys were still there. You're kind of quiet.
But I do have a question. You were saying that it could be early as the beginning, early as conceiving?
Yeah, so we know that, when most women, unless you're planning, most of the time they don't know they're pregnant until they miss their period. So I have a slide that will show you from the beginning of pregnancy until the end. And so I think it's a few slides down. So we'll cover that and it'll show you all the different things that could be affected. Okay. So alcohol causes, this is a pop quiz. So alcohol causes more birth defects than smoking and illegal drugs. So yes, no, just if you can just put it in the chat. So in addition to the effects described by the people, so I was going to have a video here, but because of our short time together, I don't have a video. Okay. And so it says in the United States, drinking during pregnancy is the leading cause of birth defects. Alcohol causes more birth defects than smoking and illegal drugs, which can be surprising to hear. We might assume that alcohol would be safer. I told you I believe that. If I had a client who said she wasn't IV using heroin anymore, but that she was drinking a can of beer, I thought that was safer, but it's not. That is definitely not the case. So this is so we got the pop quiz. Did anybody put anything in there that it was safer? Did they put anything in the chat? Oh, I can kind of see the chat, but I don't want to pull it. Yeah.
Nicole said true, and Miss Paula Harrington said yes. And I did too.
So it says, with all of this in mind, which trimester is the safest to drink alcohol? So would you say the first, second, or third? And just put it in there. I don't see anything going in. Okay. First, second, or third.
Miss Nicole said none but third. And Paula said none.
Okay, anyone else?
Pamela said none. Stephanie said none.
Good. So it said, some would think, okay, you're almost at the end. This baby's almost cooked, and so they might think that the third trimester. So that's a myth. That drinking in the third trimester, since the baby is more than developed, people think that that they're safe. But it's not true. There's no safe time to drink alcohol during pregnancy. And even if a doctor said, have a glass of wine, this might be my glass of wine if you can see my glass, so that's a pretty big glass. Or someone might have a wine glass, or someone may even have a gobble. I think that's what they call them, gobble. So it's no safe amount time, or hard liquor is no safer than wine or beer. They can all still cause birth defects. So here's I hope you can see this. So we have the 1 to 2 weeks. That's the period of early embryo development. And so we'll start at the 3rd week. So this chart can affect from the 3rd week through the 38th week. From the beginning of the first trimester to the end of the 3rd. For example, the heart is most vulnerable during the first 8 weeks. And some people don't even know that they're pregnant during that time. What is most important here is the top line, which is the central nervous system, right? This includes the brain and spinal cord, and it is developed throughout the entire pregnancy. This means that drinking alcohol at any stage in the pregnancy can impact the brain. So you see, this is your top line here, right? And so even they show the ear, So there's sometimes when babies that have FAS, some of them have a very small ear. And I should have had my bag because I got a bag that has all of the stuff in it. And I think, we kind of forget because virtually I could still pull all those things out so you can see them. Should have had it. Next time I will. So so every pregnancy is different. So how alcohol affects the fetus depends on a number of things. So there are a variety of factors that affect how alcohol exposure impacts. So some factors make the fetus more resilient to alcohol exposure, which means they might not have as many effects, and other factors make the fetus more vulnerable, so which they are more likely to have effects from being exposed to alcohol. I know that when I was doing like my training around becoming a substance use professional, there was a concentration on Native American. And so they have higher rates of FASD because what they say is that that particular population don't digest alcohol the same as others. And I don't know why that's any different, but there's research that shows it. So we're going to go through a list of different factors and keep in mind that each of these play a role in how alcohol is going to affect the fetus. So let's start off with genetics. So genetics are the genes that each parent passes on to their children. So genes affect how the child will be impacted by prenatal alcohol exposure. For example, studies have found that identical twins who share identical DNA typically have the same effects if they have had prenatal alcohol exposure. However, fraternal twins, which don't have identical DNA, can have different effects after being exposed, which that's pretty interesting because they both are in mom's belly. But even though they were both in the same womb at the same time, had the same level of exposure, researchers aren't sure yet how these genes play a role, but these examples show that they do appear to affect how vulnerable a fetus is to alcohol exposure. So, okay, next, the pregnant person's diet. So mom's nutrition. So we know that if we have someone that's a substance user, pretty much their nutrition is very low. Because the other thing is that every mom that gives birth to a child that has FASD doesn't mean that person is someone that has been diagnosed with a substance use disorder, because as we mentioned on the other slide, everyone doesn't know that they're pregnant. So mom could be drinking, and it could be like out hanging out with friends or going to a shower, and that person has 3 to 4 drinks, which is binge drinking, and the baby is affected. So mom's nutrition affects the fetal vulnerability as well. If the pregnant person is eating a really nutritious diet and they're getting a lot of minerals and vitamins, this helps to protect the baby from some of the harmful effects of alcohol, but not all. This doesn't mean that if a pregnant person is eating a lot of veggies and that it's safe for them to drink alcohol, but it does mean that eating a healthy diet can be beneficial and protective for the baby, whether there's alcohol exposure or not. So the pregnant person's age is another factor that impacts the fetus. When pregnant people are older, their baby is at higher risk in general. And this includes when there has been prenatal alcohol exposure, higher maternal age, and has been linked with higher fetal vulnerability. Using other substances like tobacco and illegal drugs also affect the fetal vulnerability. So drinking alcohol and using other substances increases the risk of the fetus. So the amount a person drinks also plays a large role in how, as I mentioned, my glass might be different than your glass. So there's no safe amount, no safe time to drink, but more alcohol exposure there is, the more risk increases that the child will be impacted. As I gave you that example earlier, Dr. D. Joseph the one child she was in recovery with and had a return to use. And that was the last child that had FAS. He had all of the facial features. And with the first one, she was not in recovery yet. And so the amount doesn't matter in that time frame. It matters, but it don't matter because it could happen just early on. But the more alcohol exposure there is, the more risk increases that the child will be impacted. So binge drinking has been found to be particularly harmful to the fetal development. So finally, one thing that actually doesn't make a difference is that the type of alcohol. So alcohol is alcohol. The one type is not safer than the other. A standard serving of wine can have the same effect on the fetus that a shot of hard liquor would. Isn't it mind-blowing how many things play a role in fetal development and fetal vulnerability? And researchers are still finding and exploring this and finding more factors. This is one reason that doctors and healthcare organizations recommend not drinking any alcohol during pregnancy. So even if you know someone that is in that range, or if they're planning a pregnancy, just to mention this to them. I remember even my husband and I were on a cruise, and there was a young lady, big and pregnant. Oh my goodness, it took everything in me not to say anything to her. But she was big and pregnant and was actually a part of the group that we were with. I didn't know her. She was one of the manager's wives, but she was big and pregnant and really throwing them down. And I was like really trying to find out how I could say something to her. So there's no way to tell how all of these factors are going to combine with prenatal alcohol exposure and affect the developing fetus. Okay, so if we have any questions, make sure you put them in that chat. So we're going to kind of go through this. So let's look specifically at alcohol use during pregnancy in the United States. So 93% of people quit drinking alcohol after they found out that they were pregnant. So of the women in North Carolina, these are actually North Carolina's numbers after they found out. So we still have that 7% remaining. There's not especially if you have a problem. If you have a problem and like you've been struggling with substance use, there's no magic bell that goes off because this woman is pregnant. She will struggle with stopping. And so this may mean that she could seek help and try to stop, or she might try to stop on her own, but she will struggle. So North Carolina's rate of alcohol-exposed pregnancies are much lower than the national average. So the national average is 13.5%. However, even at 7%, this means that over 8,500 babies are born exposed to alcohol. So let's see. So that's that 7%. Wow. So this is the estimated number of babies born in North Carolina. So we're working to inform, support, and empower people so that eventually we'll be able to say that 100% of the people here in our state, and hope that, this spills over to other places in our nation, are not drinking once they find out the dangers. I know when I started doing this work, I was just surprised. So unfortunately, despite the fact that FASD affects so many people, there's still a lot of stigma surrounding it. So a lot of that stigma lies on the mother, and there's a lot to blame and shame that she might feel. To be very clear, we do not support blaming mothers who drink during pregnancy, regardless of the reason why. But what are some of the reasons? I want you to put it in the chat. What are some of the reasons that she might drink during pregnancy? And Nancy, if you can monitor that and call out what those things are.
I wrote down knowledge. If they're young, knowledge. Even if they're older or younger, depression can come into role as well.
That's a good one because I don't think I've seen many people put that here. Depression.
Alcohol, and Nicole said stress, norms, alcoholism,
Alcohol.
yes, alcoholic,
Mhm.
because she has a SUD and hasn't embraced recovery.
Mhm. One of my things that I
Alcohol.
said when I'm trying to work on, eating healthy, and my husband is eating ice cream. So when that person is trying to stop drinking and their partner is drinking, it makes it a little harder too. So this is, everyone in the family should be have the information on this. So some of the ones that we have here in inaccurate information, as I said earlier, the doctor that says that it's safe to drink beer or wine during your pregnancy, or a friend telling you, well, I drank during my pregnancy and my baby is fine. Looking, you might even know that person. They drank the whole time and you're looking at their baby. You're just looking at what your physical eye see. So you think, well, that person drank and their baby is just doing well. So this slide will end ending the stigma. So prenatal alcohol exposure is complex public health issue. They drank before they knew. They didn't know the risks associated with prenatal alcohol exposure. A healthcare provider gave them the wrong information. They knew someone who drank. They may have alcohol use disorder. So these are all the things that we put in there. They are part of a culture. Yes. So you might have a part of a culture that in Europe, they drink a glass of wine with their meal. They felt pressure from family or friends. Yeah. Okay. So this, as we talk about FASD, it's important to remember that it's a spectrum. This means that each person in case is unique, and not everyone with the FASD will have the same characteristics. So some of the characteristics will appear during different developmental stages, which means that some of the characteristics might appear during infancy, while others don't appear until adolescence years. It's also important to note that intelligence level is not a good indicator of whether or not. So you can see a parent that has drank during pregnancy, and then their babies is, hitting all of the milestones, talking very young, walking young. They are feeling like, okay, good. We escaped that, that my baby is fine. So that intelligence level is not a good indicator, because one of the slides did mention that a person with FASD could go on to, live successful lives. Their IQ might not be affected by it. So people with the FASD can have a very high IQ, but that doesn't mean they haven't been impacted in other ways by prenatal alcohol exposure. There are some of the characteristics that someone with an FASD might have. So this is the difficulty following direction or connecting steps. That this might even lend to, like, when you have someone in your program and or a student that you're working with, and you're giving them all of the steps, and it just seems, you might even have them repeat it back to you, and they seem like they got it, and then they don't. It's gone. Or they might give you that stare where they're like a deer in headlights. So it may be that they're just having a hard time following what you're asking them to do. So poor social skills. They might have, low boundaries around the people that they keep around them. You might see some of them as teenagers begin to connect themselves to the wrong people or making really bad decisions. So slower information processing, they may be prone to confabulation. So just not telling the truth and really embellishing on a lie. And, possibly even believing it. So difficulty regulating emotions, slower to calm down, extreme under or over sensitivity to sensory things. So many of the characteristics that FASD are because of impaired executive functioning. So examples of abstract concepts that can be challenging are time, money, and ownership. Generalized concepts require being able to apply a rule from one setting to the same situation in a new setting. So memory and attention, impulse control, so abstract concepts. So I think we'll definitely cover some strategies that will help with this. Organizing stored information, planning future events, problem solving, generalized concept. Remember too, I had this young lady in the program, and I came in with one of the FASD babies in my hand, and her little boy was maybe I would say he was about 4 years old at that point. And she was recognizing some things in the baby, but didn't tell them that she was, this was a transitional program. So everyone in the program didn't have a substance use disorder, nor did she share with anyone in there that this was, that she drank during pregnancy. But when I walked in with that baby, her baby looked just like that baby. And she began to cry and weep, and then share some of the things that she recognized with him. She would tell him things, and it was just, he would give her that blank stare. And I think he was definitely about 4 or 5 years old, approaching school age. So what else can we look for? So FASD is both undiagnosed and highly misdiagnosed. So FASD can present similar to many other developmental disorders, intellectual disorders, and mental illnesses. So most children with the FASD will be diagnosed with co-occurring conditions or be misdiagnosed with several times before they receive their diagnosis within the FASD spectrum. So I know earlier we said that there is not a diagnosis for FASD, but it is for those things that are under that spectrum. So luckily, this means a lot of strategies for supporting these conditions will help in supporting those affected by FASDs. However, it can be dangerous to medically treat someone for a condition that they do not have. For this reason, it is imperative to identify the source of someone's symptom and behaviors. So we see this whole list: ADHD, autism, reactive attachment disorders. These are some of the misdiagnoses, depression, and not saying that they can't still have FASD and have a diagnosis of depression or anxiety or trauma, but many times you'll see these some of these misdiagnoses. And I'm going to move because I got a little bit time left. I think I'm at 40 minutes. Dr. Boone, is that right? I see my slides here. I just want to make sure that I don't go over the time. So much like when we taught to look for facial characteristics, which we know only impacts 10 to 15% of those with FASD, we know that FASD can co-occur with other things. One more thing to consider is that society often focuses on one's physical age. Again, when looking at FASD, so they grow up to be adults. We have an opportunity to think differently. So developmental skills do not always line up with the physical age for someone with FASD. Again, FASD is a spectrum and each person is unique. So this is just one example of an individual with an FASD. So in this example, this slide will show you that 18-year-old person. However, this is 6 years old is their comprehension, emotional maturity 6. social skills 7, concept of money 8, reading level is 16, and their expressive language is 20. So these, it's important to note that this person's expressive language actually surpasses their physical age. This is a common strength, and we can see how this might look in the next activity. I don't know if I have, okay. It's important to note that FASD may show up in treatment settings in a number of ways. Perhaps you're working with clients. So I said in treatment settings and at school, have an undiagnosed FASD. We will talk about how you can make changes to your typical treatment model or to help, so you can help them be successful. You may also have clients that are raising children with FASD. These clients could benefit from some tools in their toolbox, and this would help them too, because if they are raising a child, and if there's someone that's come into recovery or not, but if they've come into recovery, they may carry a great deal of guilt. And so you can help them, understand that, now that this person has shifted and is doing something different in their life, that, don't just sit in the grief and the guilt, but let's see if we can do something different, see how we can help you. So by helping these individuals understand FASD and knowing that some small changes can make a big difference at home, you can also help these clients have a better chance of maintaining long-term recovery. So I'm going to read this quote out loud. And so research and practice evidence demonstrates that people with FASD do not generally experience success in typical programs, given that most programs are based on behavioral learning models that assume that individuals have the memory, the cognitive, the receptive language skills to understand, remember, and carry out what is being asked of them. So I ask you to step back and just with this knowledge that you have, do it a little differently. Just take your time. I remember having a young lady that her parents had custody of her children, and she was in a partial care program where I was one of the clinicians. And that partial care, we met Monday to Friday, and the women were there from 9 a.m. to 3 p.m. And then so her family was beginning to trust her more. They were thinking about reunification with her children. And she had the opportunity to take her child to the pediatrician. And it turned into this big ordeal. She was in tears, she was hysterical. And I just didn't understand it. But then when I look back, this was one of the things she drank during her pregnancy. So she was wondering if she showed up, will the doctor realize that? Did she have to go in and tell the doctor that information? And the child had been removed. So now, hindsight is 2020. So now when I am working with someone, this comes up, and you want to comfort them and just kind of take your time working with them and treat, as we said, 1 in 20. So that can be someone, if you got 20 people in your program, in your classroom, maybe at least one of them. So let me go to the next slide. So look through a different lens. So when it comes to working with students with FASD, the first step is in getting yourself in the right mindset. So getting ourselves in the right mindset. Parents and professionals often report a significant shift in their perception once they understand FASD. This shift is from feeling frustrated to feelings of acceptance because of the students or client you may have has an organic brain injury. Some of their behaviors are results of the injury. It's not that they're refusing or that they're not compliant to do what you're telling them to do, but they might realistically be incapable of doing it. So at least not until they have the right support. So thinking of someone with dementia, which is another type of brain injury, do we think of that person being defiant, or, why are they acting like they can't remember, or, why are they just asking me over and over again what time it is? We don't think of it that way. So we recognize that their brains have been impacted in a way that affects their behavior. It's the same thing for people with FASD. So some of these things to keep in mind are, be sure to set these students or clients up to succeed by using more positive and explanatory terms. So if you have someone with an IEP, common words such as refusal or often written into IEP when it's not actually a refusal, but an inability that is making the child or look combative, as opposed to deficient in coping skills. Meet that person where they're at. Observe and note behaviors. Is there a pattern? What are their strengths? What developmental age do you seem to be at? Is there something in the environment that is throwing them off? Track that, accept the person for who they are, and build on their strengths. So, we always talk about individuals, personalized individual plans. So you're not treating everybody the same. You're treating that person to their individual personal plan. You can't change their brain injury, but you have the ability to modify how you work with them and teach them so that they can succeed in their own way. If you're feeling frustrated, take a step back. That's for you, and look at the situation. Take time to reflect on what your student or your client challenges are. Look at their strengths. Ask them what their strengths are. They're able to, if you say to them, what are your strengths and what are your weaknesses? They will give you a whole list of that. I'm almost at the end. So we all play in a role in preventing FASD and supporting those impacted by it. I thank you for showing up today. So I have the next couple of slides. The one is the evaluation, and this next slide actually is the resources. So take every opportunity to have a conversation with clients about alcohol use during pregnancy. Just ask them. They'll let you know. Become an advocate for changes as it relates to alcohol policies in your community. I mean, like now, a lot of communities, folks are just walking around with drinks in their hand. I know that we have it in Raleigh and in Durham. So learn more about FASD and how you can support those impacted by visiting Proof Alliance. And you can schedule if you wanted more of a, today I'm going to give you 1 hour of CEUs, but it'll be tied to your evaluations. But if you even wanted a 2-hour training, we're able to do that. So here's the next slide. This slide is the mother to baby. This is where Amy is at. That's the telephone number. And ADCNC is where I work. So I'm the coordinator of the perinatal substance use project there. But Alcohol Drug Council of North Carolina not only works with the perinatal project, but they have a veterans project, and they also serve all individuals in North Carolina, trying connecting them to treatment. They have a robust database where, if you had a woman that was seeking treatment and then that person had a partner, that partner could connect with FASD, connect with ADCNC. And then the last resource is North Carolina Pregnancy Opioid Exposure Project. That is a toolkit that was created, I think now it's been about 5 or 6 years, working with women that has used opioids during their pregnancy. There's guidance around opioid use during pregnancy. There's for the client herself, or there's a guideline for the professional, and there's also guidelines around NAS. So I think that's it. And we're at the slide. If you take a picture of this, it'll pull up the evaluation, and then